Hi, you guys. Welcome back for our daily practice questions. It is day 29, and you know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 70-year-old patient with a 40-pack year smoking history presents with a chronic cough, sputum production, and increasing shortness of breath. Spirometry results show an FEV1 of 48%. According to the GOLD guidelines, what is the most appropriate stage for this patient's COPD? Is it A, stage 1, B, stage 2, C, stage 3, or D, stage 4? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, according to the GOLD guidelines, what is the most appropriate stage for this patient's COPD? All right, so what do we have going on? So we're staging our COPD. It's a 70-year-old patient with a 40-pack year smoking history. They have all of the symptoms of the chronic cough, the sputum production, increased shortness of breath. But here's the thing, we like to pay attention to when we're thinking about those stages. So the FEV1 is 48%. So let's walk our way through. We know in stage 1, the FEV1 is 80% or greater, right? Stage 2, the FEV1 is anywhere from 50 to 80%. All right. Stage 3 is anywhere from 50 to 30%. So that's where this falls, right? 48 falls right there. So your best answer would be C, stage 3. All right, question number 2. A 60-year-old patient with COPD and a history of frequent exacerbations is currently using a SABA as needed for symptom relief. The patient's spirometry results show a FEV1 of 65%. Based on the GOLD guidelines, which of the following would be the most appropriate next step in treatment for this patient? Is it A, to continue using a SABA as needed, B, add a LABA, C, add an inhaled corticosteroid, or D, start oral corticosteroids for daily use? Take a moment and tell me what you got, y'all. All right. So, stem of the question here states, based on the GOLD guidelines, which of the following would be the most appropriate next step in treatment for this patient? All right, so I always tell you if they're asking about a treatment, run it back and look and see if they provided you with a diagnosis. This is asking for the next step in treatment, so we know the diagnosis has to be provided, but we got to see where we are and what stage, right? So this patient has COPD and they're currently taking a SABA, right, for management, but they're still not relieved from a symptom standpoint. Their FEV1 is 65%, so that puts us in a stage 2 category, right? Because in stage 1, the FEV1 is greater than 80%. Stage 2, the FEV1 is anywhere from 50 to 80%. So that's where that 65 lies, right? So we know in stage 1, we do that short acting, and if it's flu season, we give the flu vaccine. In stage 2, we continue with our short acting, but now we want to add in a long acting as well, right? So the best answer here would be B. We need to add in a LABA. All right, and the last question number 3. A 72-year-old patient with stage 3 COPD, the severe stage, has frequent exacerbations resulting in hospitalization. Their current treatment regimen includes a SABA PRN, LABA, and pulmonary rehab. Despite this, they continue to experience symptoms. According to the GOLD guidelines, what is the most appropriate next step in management? Is it A, add an inhaled corticosteroid, B, add a LAMA, C, start oral corticosteroids for acute flare-ups. Or D, begin long-term oxygen therapy. Take a moment and tell me what you got in the comments, y'all. All right, so step in the question states, according to the GOLD guidelines, what is the most appropriate next step in management? All right, so this patient is in stage 3 of COPD. They're currently taking a SABA-PRN and a LABA and going and doing pulmonary rehab, but they're still not controlled, right? So again, let's think about it. In stage 1, we do our short acting, and if it's flu season, we give the flu vaccine. In stage 2, we keep our short acting, we add in our long acting, we do pulmonary rehab. Remember, pulmonary rehab is 2 words, so we do it we start it in the second stage. And if it's flu season, we give the flu vaccine, right? All right, so we're in stage 3. So now it's time to add in the ICS, right? Remember, I tell y'all that's 3 letters, and we start that in stage 3. So your best answer is A. We need to add on an ICS. They're in the severe stage, and the guidelines recommend doing a short acting, long acting, pulmonary rehab, inhaled corticosteroid, and the flu vaccine if it's flu season, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1 at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or custom packages or plans, I always say either call, text, or email so that I can speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.